Assessment of the nose, mouth, and throat should be completed as part of a comprehensive client assessment or as part of a focused exam if the client is experiencing issues such as loss of smell, dental pain, or dysphagia. Examination of the nose, mouth, and throat provides the nurse with information about the integrity of these structures as well as the client's ability to smell, taste, and swallow. Assessment of the nose, mouth, and throat can also help the nurse to identify any problems with the respiratory and digestive tracts. Let's review the process of completing a nose, mouth, and throat assessment. Okay, the supplies you'll need for the nose, mouth, and throat assessment include a nasal speculum, tongue depressor, gauze, gloves, a pen light, and a good source of light. Then, prepare for the exam by ensuring your client is in a comfortable position, that your hands are warm, and that the room is a comfortable temperature. Before getting started, explain the procedure to your client and be sure to answer any questions they might have before obtaining verbal consent. Then, perform hand hygiene and collect your supplies. Now, locating the anatomical landmarks of the nose, mouth, and throat will help guide your assessment. The landmarks of the external nose include the nasal bridge, nares, and the columella, which is the anterior tissue that covers the external part of the nasal septum. The landmarks of the nasal cavity include the nasal septum, which divides the nose into two cavities called the vestibules, and the turbinates, which are bony structures that form the internal nasal walls. The maxillary sinuses are located on either side of the nose within the maxillary bone, while the frontal sinuses are within the frontal bone on the lower part of the forehead. The landmarks of the mouth include the lips, teeth, gingiva or gums, tongue, and the hard and soft palates, whereas the landmarks of the throat include the tonsillar pillars, posterior pharynx, and the uvula. The methods of nose, mouth, and throat assessment include inspection and palpation. Alright, first you'll inspect the external nose. The nose should be bilaterally symmetric and midline to the rest of the face. An asymmetrical nose can be the result of past injury. The skin on the nose should be smooth and the color should match the rest of the face. The nares shouldn't be flared outwards, as this can indicate respiratory distress. Likewise, they should not be narrowed inwards, since this may occur with an airway obstruction. No discharge should be present. Thick or purulent nasal discharge may occur with an infection. Bloody drainage is typically related to trauma or injury, and clear, watery discharge might be related to allergies. Next, gently push the tip of the nose up so you can inspect the internal nasal cavity. Using a nasal speculum and a pen light, inspect the inside of the nares. The tissue is normally slightly red and covered with fine hairs, and the nasal septum, which should be smooth and midline. A hole in the septum can indicate a perforation, whereas a lateral displacement of the septum can occur secondary to injury. Within the nasal septum exists the Kieselbach plexus, which is a network of 5 arteries. This is a common site for nosebleeds. Then inspect the nasal turbinates, which should appear deep pink without swelling and be free from foreign bodies, blood, or lesions. Swelling and bleeding may indicate trauma or infection. After inspecting the nose, you can move on to inspecting the mouth. Starting with the lips, observe their color, symmetry, moisture, and texture. The lips should be symmetrical, smooth, and slightly moist. A distinct vermilion border should be present between the lips and the skin of the face. The color should be pink in clients who have lighter skin, and there's often a bluish undertone on individuals with darker skin, which can give a false impression of cyanosis due to hypoxia. Pale lips are associated with anemia, and cracked or dry lips may occur due to dehydration or exposure to wind and cold. Angular cheilitis, or cracks and redness at the corners of the mouth, can occur in clients with iron or a vitamin B deficiency. Lesions, nodules, and ulcers on the lips or around the mouth can be related to an infection with herpes simplex virus type 1, skin cancer, or trauma from lip biting. Lip swelling can also be related to an allergic reaction or an injury. Following inspection of the lips, examine the teeth and gums. The teeth can range in color, including white, yellow, or grayish, and they should be smooth without sharp edges. Missing teeth can occur due to trauma or extraction. The gums should be slightly moist and have a distinct border at each tooth. There is a range of expected gum colors depending on skin color. Clients with light skin typically have pink-colored gums, whereas clients with dark skin usually have a darker oral pigmentation and a brown or black line along the gingival margin. Brown spots on the teeth and gums are associated with dental caries or stains. Hyperplasia of the gums can be related to periodontal disease or medication side effects like with phenytoin. Red or bleeding gums can be associated with gingivitis or hormonal abnormalities. It's important to note the fit if the client has partial or complete dentures, which should fit smoothly to the gums and stay in place during speaking and eating. Ill-fitting dentures can cause damage to the gums, leading to hyperplasia or an overgrowth of the gum tissue and inflammation. Ill-fitting dentures can also impact the client's ability to eat, which can cause nutritional deficiencies. Next, inspect the tongue, which should move freely, appear midline in the mouth, and be pink and moist. A beefy red tongue can be associated with an iron or a vitamin B deficiency, and a yellow tongue with black elongated papillae, also known as hairy tongue, can be related to fungal overgrowth associated with antibiotic therapy. Another tongue abnormality is oral thrush, which appears as white, cottage cheese-like lesions on the tongue and oral mucosa, commonly found in clients who are immunocompromised. Thrush occurs as a result of an overgrowth of candida in the mouth and can often be wiped away, leaving a reddish area or bleeding behind. On the other hand, a thickened white patch that can't be wiped away could be caused by leukoplakia, which is a pre-malignant oral lesion associated with smoking or chewing tobacco. Now, in order to inspect the rest of the oral mucosa, you'll don gloves and use a tongue depressor to help with visualization. The oral mucosa should be free from lesions and nodules, but you might visualize aphthous ulcers, or canker sores, which are self-limiting, small, painful, non-contagious lesions that can develop on the soft tissue of the mouth. Then, to best view the posterior pharynx, you can use a penlight. The uvula should be pink and dangle midline, and the tonsils, if present, should be pink with an irregular surface. It's a common finding for tonsils to be enlarged in adolescent clients. However, tonsils shouldn't be red or contain white exudate, as this is a sign of strep throat. The tissue of the hard palate should be smooth, firm, and pale, and the soft palate should be smooth, soft, and pink. The posterior pharynx should be free from nodules, masses, or exudate. Following inspection of the mouth and oropharynx, you should inspect the neck, which should be symmetrical on each side. The trachea should also be midline. Any tracheal deviation from midline can indicate a mediastinal mass or thyroid disease. To assess range of motion and function of the neck muscles, you should ask the client to move their head forward, backward, and side to side. All movements should be painless, smooth, and free from tremors. Limited range of motion or pain with movement may occur because of a musculoskeletal injury or from nuchal rigidity due to meningitis. Okay, next you move on to palpation of the nose, mouth, and throat. First, you'll palpate the nasal bridge and nares for tenderness and masses. To test for patency, gently occlude one nostril at a time and ask your client to breathe through the open nostril. They should be able to move air freely through each nostril. Inability to breathe through a nostril can be a result of congestion, nasal polyps, or a foreign body. You'll also palpate the maxillary sinuses, which should be non-tender. Tenderness of the sinuses is usually related to a sinus infection or the common cold. Moving on to palpation of the teeth, inner lips, and gums. Using your gloved hand, palpate the teeth to assess for smoothness and firm attachment to the gums. Wiggling teeth can occur due to trauma or periodontal disease. Next, palpate the gums, which should be non-tender, moist, and firm. Gum tenderness is associated with trauma or infection. Lastly, palpate the tongue, where a slight rough texture on the dorsum of the tongue is expected. Lastly, palpation of the neck and trachea is performed to assess for masses, asymmetry, and tenderness. The cartilage of the trachea should be smooth without swelling or bulges. You can also attempt to palpate the thyroid gland, which is sometimes not detectable. If it is palpable, it should feel soft, smooth, and non-tender. To further assess the thyroid gland, continue to palpate it while the client swallows. It should move smoothly during this process. As the nurse, it's your responsibility to correctly interpret, report, and document your assessment findings. If your assessment reveals something that's potentially abnormal or emergent, such as an oral lesion or mass, you should report this immediately to the healthcare provider while monitoring client progress and changes from baseline. Alright, as a quick recap, assessment of the nose, mouth, and throat provides the nurse with information about the integrity of these structures, as well as the client's ability to smell, taste, and swallow. Supplies you'll need for the nose, mouth, and throat examination include nasal speculum, tongue depressor, gauze, gloves, and a pen light. The methods of nose, mouth, and throat assessment include inspection and palpation. As the nurse, it's your responsibility to correctly assess, interpret, report, and document your assessment findings.